Congratulations on the birth of your baby. In preparation for discharge, we would like to review warning signs and home care instructions. After your discharge home, please notify your provider immediately if you experience any of the following or any time you feel that your condition is an emergency. Heavy vaginal bleeding. This is defined as bright red bleeding that soaks a sanitary pad in an hour or less, or having large clots. It is normal to have bright red bleeding for the first 2 to 3 days after delivery, but we expect that your vaginal bleeding will continue to lighten up in amount and color over the next 6 weeks. It is normal to experience an increase in bleeding when you are more active or during certain stages of uterine healing. You may also have increased bleeding when you stand if you've been sitting or lying down for long periods of time. Your menstrual period may occur as early as 6 weeks to 2 months after your delivery. Signs of infection, such as vaginal discharge with a bad odor, temperatures over 100.4 degrees, difficult, painful, or too frequent urination, or pain that becomes worse or unrelieved by medication. Breasts can also become infected. Please watch for burning, pain, red streaks, or lumpy areas in your breasts that may be accompanied by flu-like symptoms. In the postpartum phase, some women experience preeclampsia or increased blood pressures. If you experience any of the following signs and symptoms, you need to be evaluated by your provider. Unusual or excessive swelling in your face or hands, severe or constant headaches that do not improve with over-the-counter medications, blurred vision or blind spots, sudden weight gain of more than 1 pound a day for several days, or severe pain in the upper right part of your abdomen. Postpartum women are at an increased risk for developing blood clots in blood vessels. These blood clots are most likely to be identified in the lower leg. You will need to be seen by your provider if you develop pain, redness, warmth, or firmness in the lower calf. However, blood clots can travel to other areas of your body. Call 911 or go to the emergency department if you develop difficulty breathing, shortness of breath, chest pain, dizziness, or faintness. It is common for postpartum women to experience the baby blues in the first 2 weeks following delivery. However, if these symptoms last longer than 2 weeks or make it hard to enjoy life, it is time to seek help. Warning signs of postpartum depression differ and may appear days, weeks, or even months after delivery. Symptoms may include crying spells or mood swings that feel out of control, feelings of extreme sadness or anxiety, feeling that you don't want to be with your baby, feelings of guilt or worthlessness, or thoughts of harming yourself or your baby. If you struggled with anxiety or depression before or during your pregnancy, you are at increased risk of postpartum depression or anxiety. Please know there are resources available to you and do not hesitate to talk to your provider. Now, let's review your home care instructions. Rest frequently and continue to drink plenty of fluids and eat high-protein snacks. Gradually increase your daily activities until you're back to your normal routine. Do not put anything in your vagina for the first 6 weeks after delivery. This includes avoiding tampons, intercourse, and douching. These things can put you at risk for infection. If you have received stitches in the skin near your vagina, these can cause some discomfort and itching as they heal. Your body will heal quickly though and should cause you less discomfort every day. These stitches will dissolve within 2 to 4 weeks. Until then, you can help reduce discomfort, aid healing, and reduce your risk of infection by keeping the stitches clean. You may find it helpful to continue use of your peri bottle, witch hazel pads, and topical numbing spray given to you at the hospital. It is important that you change your pad on a regular basis. It is okay to shower or tub bathe. Postpartum constipation is common and may be increased by the use of iron, narcotics, or abdominal surgery. In addition to increasing your fluid and dietary fiber intake, there are several over-the-counter remedies to alleviate discomfort, such as stool softeners or laxatives. Painful bowel movements or rectal pain may result from hemorrhoids. You may use witch hazel pads and/or over-the-counter topical treatments to decrease discomfort. Sitz baths can also help. If you are still having issues with constipation after 5 to 7 days postpartum, you can discuss other options with your provider. When breastfeeding, latching should not be painful or cause cracks, blisters, or blood on your nipples. If you are experiencing these symptoms, consider following up with outpatient lactation services or contact your provider for other resources. Your colostrum is a natural lubricant that provides healing and protective properties. You may find it helpful to rub in the last few drops into your nipples after each feeding. You may also find comfort using lanolin or hydrogel pads, which can be purchased at most stores that sell breastfeeding supplies. If you are separated from your baby or have been advised to pump, it is important to pump at least 8 times per day to ensure an adequate supply of milk. Many insurance companies will cover the cost of a breast pump when you have a prescription. Let your nurse or OB provider know if you need a prescription for a breast pump. A local lactation consultant, OB provider, or pediatrician can be a great resource if you are needing specific guidance or if you have any additional questions. Return of fertility is often immediate for women, even if you had trouble conceiving this pregnancy. If you do not have a plan for birth control, talk to your provider to help you decide what is right for you. Please note that breastfeeding is not effective at preventing pregnancy after delivering your baby. Waiting to become pregnant again is also important for the health of you and your future pregnancies, especially if you delivered by C-section. Talk to your provider about getting pregnant again. If you had a C-section, it can take time to fully recover. There are a few additional precautions worth noting. First, watch your incision for signs of infection, including redness, pain, or discharge at the incision site that gets worse. A small amount of clear drainage is normal as your stitches are dissolved by the body. Avoid heavy lifting. Don't lift anything heavier than your baby, or about 10 pounds, for 6 weeks, or until your provider tells you otherwise. This includes your car seat. Do not drive while you are taking narcotics. Your provider should let you know when it is safe to resume driving. It may be helpful to try driving maneuvers while parked to ensure no increase in incisional pain. If steri strips were applied to your incision, these may fall off on their own or can be removed at your post-op visit. Lastly, you may find it helpful to apply pressure to your incision with a pillow or abdominal binder while laughing, coughing, or getting up from a lying or sitting position. Avoid bathing or soaking your incision in water until 6 weeks postpartum or until okayed by your provider. It is okay to shower, just pat your incision dry afterwards. Whether it is your first time or not, becoming a new mother is one of the most exciting and defining moments of a woman's life. Thank you for letting our team be a part of it. Please let your nurse know if you have any further questions or concerns before your discharge home from the hospital. This video was produced by the nursing staff on the Mother-Baby Unit at Providence Sacred Heart Medical Center to help ease your way home.